was kind enough to share it with us. So this is brand new, hot off the presses, hasn't been published, hasn't been presented. As you heard, the idea is that there's a draft combine that occurs now. The data set that's created from this combine includes the current complaints of the players, their current injuries, their medical and surgical histories, physical examinations that were performed on all players. There's obviously some heterogeneity there. The examinations are all not by the same person, and there's heterogeneity in which maneuvers they performed. But then the real key is it includes imaging. And the imaging part is really interesting. So every player got MRIs of cervical spine, lumbar spine, dominant shoulder and elbow, and then x-rays of hips and knees. And a lot of what we have to share is from that. So the first thing I want to share, which I think is, this is again, brand new, really interesting data, that there's a pretty substantial prevalence of prior surgery among these players. So depending on which you looked at, it's somewhere around 25% had had a surgery at some point before coming into the draft. UCL repair reconstruction is the most common of those surgeries, but still the minority of players. Shoulder surgery, really, really uncommon. So, and really, really uncommon specifically on the dominant side. And then knee surgery, also relatively uncommon. So I'm going to go through some imaging findings, and I wanted to pull these up specifically because there's a lot of people in the room that take care of youth players, and these are things that we're seeing in players that are being drafted. So the reason why this data is valuable is these are players that were healthy going into the draft, planning to play professional baseball, things that we're seeing, many of them in asymptomatic players. And I think that that gives us a real basis by which to judge when someone comes in with pain,